Hello again. In our last section, we will focus on antifungal, antiviral, and antituberculosis. First, I'm going to start with the antifungals. So let's look at the classes of antifungals to make it easier for all of us. Okay, so the first class is pollines. And we have under polline is either nystatin or amphotericin B. Nystatin is mainly used as a topical, and amphotericin is for severe infection and comes in IV formulation. The second class we have the azoles, which is divided either to imidazole or triazole. Example of the imidazole are miconazole, ketoconazole, etc. Triazoles, examples of them are fluconazole, voriconazole, etc. We also have alamines, and you will see of it maybe the most common one is terbinafine, which we will talk about in further details. Another class under antifungal is the beta-3-glucan synthase inhibitor. Examples of this class is caspofungin, micafungin, and andulofungin. In this class we have others because they are not under any class, and we have here griseofulvin and for example here fluocytosine. Okay, in this slide I'm gonna talk about the antifungals mechanism of actions, and first I would like to emphasize how is the cell looks like of the fungi to give you an idea about the mechanism of actions of each antifungal. Okay, first is I would like to emphasize that the development of antifungals is difficult because fungal cells closely resemble the human cells, which means antifungals might cause great toxicity to the human if they resemble the human cell. Okay, so we have here in the cell wall ergosterol, which is a part of the cell wall. We have also chitin as part of the cell wall, beta-1,3 and beta-1,6 glucans, and mannose. Just like with the antibiotics, the antifungals work mainly on the cell wall. They also work sometimes on the DNA synthesis. Okay, first I'll try with the pollines and azoles because they both work on the ergosterol. Pollines like amphotericin B bind to ergosterol, which is part of the cell wall. Therefore, it's gonna weaken the cell membrane and cause pore formation. From the pore formation, there's gonna be leakage of the content of the cell, like potassium and sodium. Then that is gonna cause fungal cell death at the end of that. So this is how it works, mainly directly on the ergosterol. Azoles, on the other hand, like fluconazole for an example, it inhibits the enzyme that synthesizes the ergosterol, so it's indirectly work on the ergosterol. Okay, I have here the griseofulvin, which also inhibit the cell wall synthesis as well. Terbinafines also is an ergosterol inhibitor. So basically polline, azoles, griseofulvin, and terbinafines all work in the cell wall. Let's move now to the echocandians like caspofungin, andulofungin, and micafungin. They inhibit the enzyme that synthesizes beta-glucan, and this is how it can affect the cell of the fungi. Last but not least, let's look at the 5-fluocytosine or 5-FC, which is converted to 5-FU. The 5-FU is worked by inhibiting the DNA synthesis, which is as pyrimidine analog, and the side effect of this is mainly myelosuppression in the human being. So that's it for the mechanism of action of the antifungal agents. The most common fungal infections are either local or systemic. Most commonly, even in the healthy humans, you will see the local infection, which we call tinea. We have very common what we call athlete's foot, and ringworm, which are part of the skin infections. Systemic infections of the fungal infection are luckily less common but very severe. They are common in patients who are severely immunocompromised, like AIDS patients or patients who are going under transplant, for an example, or who are giving high doses of oncology medications. Examples of those are blastomycosis, histoplasmin. We have also mucormycosis, aspergillosis. Maybe if you went through infectious diseases rotation, maybe you've seen patients with yeast, which is very common, candida infections, and pneumocystitis. So those are the type of fungal infections.